Welcome to the podcast. I'm Dr. Spiro, 29 years in practice, board-certified plastic surgeon specializing in cosmetic surgery, specifically facial aesthetic, breast and body aesthetic surgery, and breast reconstruction. I'm here joined today by my superstar injector, Mikayla, who is our certified plastic surgery nurse, specializing in injectables, also my assistant in the operating room. And we're going to talk today about Botox.
Thanks for having me.
Welcome. Mikayla, tell us about your role here at Spiro Plastic Surgery.
Yeah, so I'm a board certified nurse practitioner. I've been here for about 3.5 years. I see post-op patients with Dr. Spiro. I'm also in the operating room with him. I do all the injectables like Botox filler, skincare treatments like microneedling and lasers.
Well, you do pretty much everything here at Spiro Plastic Surgery that I don't do. In fact, I've abdicated my role as the chief injector here after decades of doing all the Botox and filler injections. And you're so good, I basically don't do any more injectables anymore.
Not anymore.
You're doing all the Botox here in this practice. And I want to focus today's podcast on that. I want to talk about Botox. So we're not going to do a Botox 101 podcast. We're going to do a deeper dive. And Mikayla, let's get more sophisticated for our listeners. Let's let them hear how you plan it out, how we collaborate, what makes Spiro Plastic Surgery and you in particular so much more different than other Botox injectors. Where should we start? What area of the face should we talk about first?
Well, everyone knows that common areas of the face for Botox are the upper third of the face. Everyone gets their forehead done, their crow's feet. But now a lot of the times patients are getting lower face Botox. So we're doing it for downward turn smile. They're doing masseters for facial slimming or TMJ pain. We just got approval for platysma band Botox for the neck bands. So we're also balancing the lower half of the face with the upper half of the face as well now.
Right, so this is getting really sophisticated and you hit on first around corners of the mouth, and this is so important. You have to be a really good injector to get this right. As everybody knows, there's a lot of wonky injections out there being done by not really skilled injectors, unlicensed and not using real injectable Botox or neuromodulators, neurotoxins. So Mikayla, take us through first how you can manipulate somebody's smile, manipulate lines around the face.
Yeah,
Tell us a little bit about that.
A lot of patients come in with these vertical deep lines above their lip. You can add a little bit of Botox there. It will soften those lines. You can also, patients who have a downward turn smile, you can inject a little bit of Botox into the DAO muscle to turn that up. But what often happens is that they go to an injector that doesn't know the anatomy, and you can hit a muscle that's right next to it, causing the smile to slant.
Right.
So you have to be very careful with that. And you can also do a little bit of platysma bands in the neck. That also helps with
And that all
elevating.
is interrelated, right?
Yeah.
Platysma and DAOs. And if you really don't know the anatomy and you don't hear it like we hear it, you guys hear it in our practice from all my facial aesthetic surgery, and when you're in the operating room, you see that anatomy. You can sort of visualize as you're talking to somebody in a consult, right? So take me through when you bring somebody in and they go through a consult with you. How do you plan out how you're going to inject that area?
So typically the patient comes in, we take photos, and we look at them together. And patients typically will say, well, I either look tired or I feel like my face is sagging. They don't really pinpoint what they want. So I go over from top to bottom, full face assessment, Botox, fillers, skincare, because a lot of things are not just from Botox,
Right.
not just for Botox. And then I go over why things are happening, why things are the way they are. Maybe it's the downward turn smile. Why is it like that?
Mhm.
They need their DAO plus the platysma bands. It's not
Right.
just one muscle group. So that's kind of how we plan everything out. We look at it together. I explain scientifically why is everything happening. So we
Right.
go over an advanced anatomy in every consult.
Okay, so let's stick around the mouth. And what about one of the more common things, the person who comes in with a gummy smile?
Yes, with a gummy smile, it's easily treated with Botox, a couple units above the lip. It will
Mhm.
bring that lip down a bit, and it makes for a really nice result.
So when patients are thinking about this, the mouth is very sophisticated in how you have to plan injection patterns. And really listen to what Mikayla is saying. It shows a lot of insight and sophistication in how she's doing it. So when somebody has a gummy smile, they're actually, when they animate, they're showing too much gum,
Mhm.
and it can be a less than attractive look. So if you don't do it right, what could happen to them?
If you don't do it right.
If you over inject a gummy
Oh,
smile.
I mean, you can drop it too much and then you won't see
Right.
teeth.
Right.
Obviously, the aesthetic would be to see a little bit of teeth when you're smiling.
And if you do it well, tell me how that is. People hear the term the lip flip.
Lip
So
flip.
tell me about
Yeah.
the lip flip.
Lip flip and a gummy smile is a little bit different.
Mhm.
Sometimes I do it on patients. I do both. So I just had a patient recently. I did both on her.
Mhm.
So her top lip just curls in when she smiles, but also she shows too much gum. So you have to kind of, combination. So you have to do a little bit right underneath the nose, a little bit right above the lip, and it will act both ways. It'll drop the smile a little bit, but it will also flip out the lip.
Right. So there's really incredible beauty especially, no offense, guys out there, but in a female mouth, and the sophisticated Botox injection of how you can manipulate, as Mikayla is saying, and get three-dimensional
Mhm.
beauty back into the central part of the female face. So there's a lot of little subtleties to
Yeah.
this, a lot of little subtleties. Let's move on to another area that maybe not as subtle, but we're going to bounce around a
Mhm.
little bit. What about Botox for hyperhidrosis or for
It's
the
one of my
armpits?
favorites.
Okay.
I love
So
it.
let's talk about it.
So for excessive sweating,
Yes.
hyperhidrosis,
Yeah.
in the underarm specifically, you can add some Botox there and it will help decrease the amount of sweat, decrease the amount of odor
Mhm.
by decreasing the amount of sweat. And that typically can last like anywhere from 6 months to 12 months. So patients get a really good result and longevity with that.
So that lasts a lot longer than the Botox in the
Yes.
face we're talking about, right?
Mhm.
Because the action is different.
Yes.
In hyperhidrosis, the Botox is going after the little microscopic muscle curlicue bundle that's around the base of the hair follicle sweat
Yes.
gland. But in the Botox we're doing in the face, it doesn't last typically
No.
6 to 12 months.
No.
What would you say the average length of time
I would
somebody
say
would
about
get from a Botox
3 to 4
injection?
months. But some of my patients are getting 6 months out of it. It all depends.
Okay.
Every patient is different.
So we're going to skip around again. We do a lot of facial aesthetics here, surgery here at Spiro Plastic Surgery, particularly eyelid surgery and brow lifting with our deep plane high smash facelifts. So I want Mikayla to talk a little bit about how she manipulates patients in the forehead eyebrow region and how you look at existing lines in the face, how you might address it a little differently in the 30 to 40-year-old patient versus maybe the 50 to 60-year-old patient.
Yeah. Patient who's typically in their like 30s to 40s, you typically don't need to worry so much about extra skin in the upper lids. They might be like an easier patient to treat. Typically, they don't have a lot of deep lines. You don't have to worry about dropping their brow, that dreaded droop. So usually with them, it's a little bit more modest, and you can get a really good result pretty quickly and easily for them. For patients who are in their 50s and 60s, you have to look for that extra skin above their eyes. Are their brows a little bit lower? Do they really technically need a brow lift or a blepharoplasty? Those patients, they come in, they want every line in their forehead gone, but they also want a nice eyebrow lift. Typically, they can't get both.
Got it.
So usually it's a long discussion talking to them about what's more important. Would they rather have their eyes open, or would they rather have no lines on their forehead? And oftentimes they do have a little bit of movement, not too much to have those deep lines on their forehead, but just enough to be able to open the eyes to prevent that dreaded droop.
So you've heard about the dreaded droop. You're hearing how Mikayla really thoughtfully plans out how to avoid that. And there's been a lot out there lately about the DIY Botox. Mikayla's explaining there's no way DIY Botox can get this sophisticated.
No.
So tell us a little bit about the backlash of the DIY Botox.
Yeah. So patients are getting DIY Botox. They're getting it overseas. So it's not real
So
Botox.
they're buying the Botox.
They're buying it. Because,
online.
Yes.
Not real neuromodulators that are sold
because you need
in
a
the
medical
US.
director to buy it.
Yep.
So they're buying it online, and they're actually using injectors patterns that they're posting on TikTok. So they're using that, and they probably don't have the same anatomy as the person that they're doing it on.
Right.
They're following injection points, and they're injecting themselves.
Or having a friend inject them,
Yes.
which is even worse.
Yes, and they're saying...
Actually, I don't know what's worse, doing it yourself or having a friend inject.
Yeah, and they're saying that, you know, a lot of injectors are unhappy with the DIY Botox because we're losing out on money.
Right.
But really, it's safety.
And safety is a big issue. It's safe in the hands of medical professionals.
Yes.
It's unsafe when you're not a medical professional. And furthermore, the product you get, you know, people hear about, first of all, you know, it's hard enough explaining to people this is not botulinum toxin that you hear about botulism, right? But when you get unregulated product from overseas, they're maybe buying expired product, not FDA regulated, the least of which, that's illegal. Like, you can go to jail for injecting somebody with product that's not FDA approved. So, yeah, so that's ever more reason why you should seek out an experienced injector such as yourself. Now, there are a lot of people who do injections, and basic Botox done simply, probably, you know, there's a lot of people that can do that and you can get by with it. But upper level, high level, sophisticated facial manipulation that you're talking about,
full
is
face
something.
balancing.
Full face balancing, love it, love that. That name is really something that's got to be in the hands of a sophisticated, experienced injector. Now, tell our listeners a little bit about the behind the scenes stuff, like complex patients you think really maybe more surgical candidates, or patients who are great Botox candidates, but our collaboration, because I said at the beginning, although I abdicated and Mikayla does all the injections, she still keeps me part of the process.
Yes.
So
So
our
I
listeners a little
think
bit
I'm
about
very
that.
lucky that I work in the OR with you, and I've always seen post-op patients, so I know when a patient probably is ready for surgery or is more of a surgical candidate. And we talk briefly about that.
Because
and then I
there's
send them over
limitations to what it
Yeah,
can do.
absolutely. And then there are times where patients either they've been getting Botox for a really long time, something maybe isn't working for them anymore. We've tried a couple different things, and I bring them to you. Behind the scenes, I collaborate with you often, and we talk about different patterns for these patients, what can work.
Right. Tell our listeners a little bit about microdosing.
Yes, we love to microdose. So we often microdose the forehead, which is common.
And what exactly is microdosing?
Well, microdoses is when you put a little bit amount of Botox in one area. You can be very precise, so it's really great to do right above the eyebrows. So patients who have really deep lines right above the brow, I tend to really microdose there superficially because that will prevent dropping the brow. You can be really precise that way. I think not many injectors are microdosing.
Yeah, there's this trend out there to oversimplify injection patterns.
Yeah.
And I think now more than ever, and I think, it's because there's a million people trying to be an injector.
Yeah.
And now there's countless people walking around out there with these
Spock
really
brows.
weird Spock brows or heavy midline forehead that is actually counter aesthetic. Like
Yes.
it just doesn't resemble the beauty of a soft feminine face anymore. They're overly harsh. So tell me about how you manage that. If somebody comes to you and has that, and you want to sort of rescue them from that pattern, how are you going to do that?
Yeah, that's easy. Usually the Spock brow is from just really focusing mostly centrally on the forehead, which they're probably not microdosing either. And patients often come to me and say they've had a bad experience elsewhere because they had a Spock brow. But I tell them it's super easy to fix. You just need a small amount of Botox right above that Spock brow and it will calm it down.
Right.
I usually have my patients come back at 2 weeks the first time I inject them for a follow-up just to be sure that they don't have a Spock brow and their adjustment doesn't need to be there doesn't need to be a dose adjustment made.
Now we've left throughout this whole podcast, we've sort of left the men out for a minute, but let's talk about Botox.
Botox.
Got to talk about the men.
Yes,
Let's talk about Botox.
Men get Botox too.
Yeah, of course. So
men
let's discuss it.
men typically have stronger muscles and require a little bit more Botox.
Big point. Yeah. Right.
But we have a lot of men that get Botox.
And what about men who say, well, I like to animate and I still want to maintain some, visible animation.
Yeah.
Like me all the time.
Yes.
So sort of segueing from how sophisticated you are in your approach, how do you handle that?
Well, every patient's different. Some men want less lines. Some men still want lines. Yeah. A lot has to do with just, listening to the patient. How much movement do they want? Do they want just softer lines? You can still get a natural result and still move having Botox in your forehead. And I think that's a common misconception is that you have to be frozen.
Now, what about some men who want Botox to help manipulate maybe masseter or jawline? What can be done?
Yeah, we have a lot of patients that are doing masseter Botox either for TMJ pain or for some jawline slimming, which works really well. So yeah, that's an option. If you're a candidate, you have to have large masseters. I have a lot of patients that come in that really have a slim face and they want it done. They're not really a candidate for that.
There are people you will tell, hey, what you're asking me for isn't necessarily maybe something they've heard on TikTok, read somewhere. They're not interpreting it right. So you may call the time out and say, let me just re-educate you. Speaking about re-education, let's talk about what Botox can't do. So what about now all of a sudden people are saying, oh, well, I want Botox because it's going to lift my face.
Yes, because everyone is talking about the Nefertiti lift with Botox.
Yeah, so let's talk about that.
So I get a lot of patients that want to do platysma band.
Egyptian queen, maybe
Botox.
Second or third dynasty for you history buffs, but let's go back to...
Yeah, so I have a lot of patients, they want to do the neck bands, Botox. They want to lift. And not many people are candidates for it that walk in here. They have a lot of extra skin. The skin quality is not great. And that's when we discuss a neck lift or facelift. So that's when I send them to you.
So the meaning of a Nefertiti lift means what, really?
Usually for prominent neck bands, those patients we can
try to
soften
get
those
a
bands.
Smooth, long, elongated, classic neck.
Yeah, and when you're doing that, you're also getting the whole platysma muscle, your platysma bands, even up here. So it is injecting slightly on the jawline, and it can give you an effect of a tighter jawline. But a lot of patients do this and they
Yeah.
pull back extra skin, and it doesn't do that.
Right.
Botox cannot lift.
That's where I come in.
Yes.
That's where my platysmoplasty, central cervicalplasty, high SMAS deep plane composite facelift, that's for me, right?
Yes.
Now, back to that, because you know the anatomy, right? I mean, other injectors can't compete with you on this stuff. They haven't seen the anatomy over and over and over again. Like, you know, the platysma is a trapezoidally shaped muscle that basically follows my hand, is both in the face. People think of it as a neck muscle. There's two halves. As we age, it falls, separates, creates the bands, creates the jowling. So management of expectations, right? What can we do? What can't we do? And you've got an incredible following. You're building it every day. I know the people around, the suppliers and the reps talk about Mikayla as being a superstar injector, which I'm going to take some of the credit for as her trainer, mentor, and teacher. But I love our collaboration. Is there any other area of Botox manipulation of the face that you want to go into?
I don't think so. We touched on mostly everything. We're just doing a lot of masseter, a lot of neck Botox, a lot of chin dimpling Botox, and lip flip. Those are the main ones in lower face now.
Chin dimpling, that is another area I just want to briefly hit on, because that doughy chin is important to address, because if you inject it not in the right spot, you're going to get a lip that falls. You won't be able to purse your lips. So talk a little bit about just the dimpling of the chin.
Yeah, so patients often don't realize that it's from the muscle, that you can, soften that muscle, and they'll actually get that pebbling or that orange peel. Everyone says that orange peel looking texture.
Exactly.
So just, I usually will point it out to some patients. Sometimes when they're talking, you notice that they shrug up their chin constantly. So I'll bring it up to them. It just takes a few units there, centrally into the chin, a few units.
And a lot of that, correct me if I'm not correct on this, but a lot of that is looking at a face and knowing who's got a long face, who has a short face. In a long face, they're hyper animating to keep the lower lip up in position. And they need to maintain that. Right? Yet somebody who has sort of average or ideal facial balance features, who may have that doughiness, they're gonna,
they'll benefit.
They're gonna have a different sort of game plan how we address it.
Definitely.
So. Well, before we wrap things up about this great Botox podcast, everybody out there wants to know about pricing. How much do you charge? It's all about that. So it should be all about, your sophisticated approach and great reproducible outcomes. But we're known in this area as being very honest and very transparent. I mean, that's part of our reputation. So tell our listeners how we approach fees and pricing for Botox.
Yeah, so we charge by unit, not by area, which is pretty common.
It should be by unit, because you walk into a room and there's a syringe of clear liquid. You don't even know what you're getting half the time. Like somebody has crow's feet. Well, what if somebody's crow's feet are more significant than the other?
Especially like forehead. Everyone's forehead is different. So I have patients that are getting 10 units in the forehead, and I have patients that are getting 30 units in the forehead.
Right. So they should be charged by the unit, not by an area or by a syringe. It never made sense to me. To me, that was kind of a ripoff when people did that.
Because some patients may benefit from getting charged by area, and some may not.
Right. So I think you got to be just fair, and we're out in the open about that. And we're going to have Mikayla come back to talk about lip lift, lip filler, or lip flip.
That's exciting.
Okay?
That's a good topic.
That was a tongue twister. Well, I hope you are if you're not one of our 12,000 Instagram followers, you should follow us on Instagram. If you haven't watched our TikTok videos, then watch that. Follow us on Facebook. It's been a pleasure talking with you today. And thank you, Mikayla, for being just a great guest today.
Thank you. Thank you for having me.
Appreciate it. See you next time.